I am sitting here with your roommate, and I was so excited to learn that you had some questions, so I wanted to get you on the line so we can get your questions answered.
Well, to answer the one, I was kind of curious as to why you were doing the other biopsy today in the office. You said that you wanted to get a sample of the lymph node before surgery.
Yes, because sometimes that will give the medical oncologist more information to know what they might end up doing. So when she has her visit with them, they'll have a conversation about proposed treatment, but the final won't be, of course, until after surgery. So it just allows me to get a preliminary stage. And then she'll
have... still bill at stage 2?
Correct, yes. And this is her clinical stage. But then I'll get a stage after this biopsy and after surgery to let me know what her histological stage is, meaning what is her stage based on the actual tumor sampling versus just on the clinical findings and on the imaging findings, i.e. her mammogram and ultrasound.
Okay.
Did that answer your question?
Yeah, so you'll still take a lymph node or some lymph nodes a day when you go in to do the actual surgery?
Yeah, she'll have the sentinel node biopsy. Sentinel means first. So the first node to uptake the blue dye is what I will remove, and any other nodes that uptake that blue dye I'll remove, and usually that involves about 1 to 3 lymph nodes. I mean, we used to remove them all, and that could be upwards of 40, 50 lymph nodes, and there was so many complications carried with doing a complete axillary dissection, which is removing all the lymph nodes. So now we understand that to get adequate staging, 1 to 3 sentinel nodes is sufficient for most tumors. Yeah.
And what is the size of her tumor?
I'll have the intern to see what the size was today. Do you mind, Ty, looking at her ultrasound to see what the size? But sometimes there can be microscopic tumor cells that are invisible to the surgeon's eye and also invisible on mammogram and ultrasound, so that's why I go widely, but I won't know anything other than that the tumor that I feel and that she feels is out. But in terms of the additional margins, I won't know until a week later when the pathologist looks under the microscope to see if there are any residual cells floating in the vicinity. And that's why radiation is so important, because oftentimes as clinicians we can't see the cells that are they're still circulating in the breast, so the radiation will help take care of those.
Right. And she will talk to the
radiation oncologist. Yes.
Beforehand, but she won't do any of that until after the surgery.
Correct. So usually any additional treatment is 4 to 6 weeks after surgery. So, for example, after her surgery, if radiation is next, that won't be for 4 to 6 weeks after surgery. And then if the medical oncologist decides that chemotherapy will be more helpful than harmful, based on her oncotype score, which is a special score that they take from the tissue to assess, the tumor grade in biology to see if chemotherapy will be of benefit in terms of recurrence. That is done 4 to 6 weeks after radiation. So everything is staged out to give the body the time to heal before going on to the next aspect of treatment.
Okay.
Yeah.
And will the actual surgery, is it going to be just like a small incision, or is this, I mean, you kind of called it a partial mastectomy, so...
It'll be just large enough to get the mass out, and that's not something I can predict just off, hand. I usually do my surgical planning before, but I do my definitive plan once I'm in there and I see it, feel it, touch it. But there will, remind you, I also will be taking lymph nodes from underneath the arm, so there may be 2 incisions, one on the breast and one underneath the arm. It just depends.
Right.
If I'm able to get like everything out through 1 incision, I'll do that, but otherwise it'll be 2.
Okay. And of course she won't be lifting or doing anything like that.
No heavy lifting, nothing over 5 pounds for the first week, but after that she can just do what feels right.
Okay.
So no picking dogs up. I have two little Yorkies.
Oh my God.
One weighs 10 pounds and one weighs about 6.
I used to have a Yorkie.
Yeah, they're sweet.
I
They're
had my
sweet dogs.
Yorkie for 17 years. I teased my Yorkie. Karen I used to tell my Yorkie Caesar that he's lasted longer than any man I've ever had. He died after 17 years, but he outlasted them all.
Well, ours are our babies since neither one of us ever had children, and the dogs are our babies.
That's why you guys will live a long time.
That's right. That's right. Tell ya.
I'm hoping this is helpful, and I'd share with her. If you come up with anything between now and surgery, please write them down. You can ask me on the morning of surgery. You can, always call the office. I'm here on Wednesdays and Thursdays, so we'll try to get the questions answered then as well. But I'm hoping, Carrie, this has been helpful.
Yes, most definitely. I appreciate it.
Oh, happy to do it.
She's not used to being sick, so she's not used to asking questions, unlike some of the rest of us,
Yeah, no, I appreciate that, because when everyone asks questions and get everything on the table and we're rowing in the same direction, it makes for better, I think, relationships and better outcomes moving forward in terms of the communication
Right.
and comfort levels. So I insist upon it. I enjoy them.
Very good. All right. So, you're going to share with her when have you been able to schedule the surgery and stuff, all that?
My scheduler will kind of look into that. So I'll check with Tiffany. I have a team that does that. And so whatever date they gave her, I'll be waiting for her with bells on whatever set date and time.
Whatever set date and time. Okay.
And can you ask